Do you know if the hypoechoic fibers visualized in these ultrasound images of the subscapularis tendon of the shoulder are representative of rotator cuff pathology? The answer is no. In the short axis, it is normal to visualize vertical hypoechoic striations of muscle between the subscapularis tendon bundles where they attach to the lesser tuberosity. This is the normal appearance of the subscapularis tendon in this plane and should not be mistaken for pathology. While performing MSK ultrasound of the rotator cuff tendons, the examiner should also be evaluating the tendons for pathological findings such as tendinosis and tears. This is an example of a partial thickness tear of the subscapularis tendon, first in the long axis and next in the short axis. You can see that I'm demonstrating the anechoic defect with the circle, and it's also superimposed on tendinosis. Next, this is a full thickness tear, meaning that it goes through the entire thickness of the tendon. These are things you want to study more about to learn how to describe the different characteristics of the tear. When evaluating the rotator cuff tendons for any pathology, you also want to look at the underlying humerus for any cortical irregularity. That's what I'm pointing out with the arrows in this image. This is cortical irregularity, meaning some sort of disruption or change in the bony appearance, and in this case is of the lesser tuberosity where the subscapularis inserts. When evaluating the rotator cuff, you should also be looking at the overlying subacromial subdeltoid bursa for any complex or simple fluid indicative of bursitis. If you want to learn how to scan the rotator cuff on ultrasound, I can give you MSK ultrasound training. It is important to learn the appropriate scan techniques and protocols for each MSK exam to be able to provide diagnostic images. MSK ultrasound is emerging as a valuable tool in the evaluation of musculoskeletal injuries, but must be performed by a trained clinician. If you would like to learn more about my training options, either send me a message or visit the training tab on my website, www.learnmsksyno.com, to fill out a request form so I can send you a proposal. Hope to meet you in 2025. Have a great day.